Alrighty guys, we're going to talk about the obstructive shock process. So we've talked about kind of all the 4 different ones. Obstructive shock can be the hardest one to conceptualize. So let's walk through it and what you need to know for your boards. So when it comes to obstructive shock, think of things that are obstructing the blood flow to the cardiopulmonary system. So think of a pulmonary embolism or a tension pneumo. So things that are going to obstruct that blood flow. How these patients are going to present is cool and clammy skin. This is due, again, to the increase in the systemic vascular pressure. Your body is trying to pump out as much blood as it can to the organs and to the tissues. Since it has an obstructive process going on, it clamps down into that systemic vascular and causes your pressure to go up. Cool, clammy skin is a result of that. What you're going to have is a drop in your cardiac output. Again, cardiac output is heart rate times stroke volume. Because you have an obstruction, something that's causing the blood flow to not be able to get to the left side of the heart, you're going to have a drop in that cardiac output, drop in that stroke volume. Why you're having that is because you're going to see that obstructive process usually coming from the lungs. Think of a PE or some type of tension pneumothorax that's impeding that blood flow going back into the left side of the heart. So you'll have an increase in your central venous pressure. That's because your preload is not affected. Actually, because of that obstructive process, it backs up and it causes an increase in the central venous pressure. But you're going to have a drop in your pulmonary capillary wedge pressure. That's because something is obstructing the ability for the blood flow to get to the left side of the heart, and you're going to see that drop there.